So if we really want to get in front of longevity and living longer, let's be concerned about our musculoskeletal health. Now, I want to point out, prior to 2002, menopause hormone therapy were very common. Analysis of their own data that showed that there was an increase in breast cancer for women who took estrogen. Now, don't turn off the podcast there. That data has been completely refuted, including by most of the researchers who did the original study, and I'm going to give you the data right now.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 19 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. In this wonderful episode, Dr. Vonda Wright, orthopedic surgeon, longevity advocate, and pioneer of the musculoskeletal syndrome of menopause, joins us to explain the silent crisis of osteoporosis and musculoskeletal aging in women. From the overlooked role of estrogen in bone density to the long-term consequences of low muscle mass, Dr. Wright explains why bone health is not just structural, it's metabolic. We discuss the importance of early intervention, strength training, and hormone optimization, and how lifestyle habit in our 20s and 30s shapes the way we age. This is a must listen for anyone who wants to feel strong, vibrant, and empowered at any age. A huge amount of people who watch Soberhead frequently are not subscribed. So I will ask you a quick favor. Hit that subscribe button now, because when you subscribe, it helps us to make the show better and provides better access to the world-leading experts. I'd like to thank Gedik University and Gedik Foundation for their trust in Soberhead Podcast. With their support, it is possible for us to bring you this content at this quality for absolutely free. Our host for this episode is .sub, the space, community, and platform where creatives, experts, and entrepreneurs come together at the meeting point of continents, the Bosphorus. Follow the link in the show notes for more information about events and membership. Subscribe, like, and share, and I promise to continue to bring you a better Soberhead every day. Dr. Vonda Wright, finally. Welcome to Soberhead Podcast. What an honor. This topic that we're going to be talking is hitting home. And let me lay the ground. My family, we struggle with osteoporosis. And I was able to learn it by luck. I did, because I'm in this now longevity biohacking, I went to have these screenings. And in one of the screenings that, they were doing actually CT for lungs, thorax CT, they say oh, you have osteoporosis. Then from there, we started digging into it. Since then, I'm very obsessed about it. And I watched you on stage. I watched many podcasts that you were a guest. Your Instagram is phenomenal. You just create these challenges, motivate people. So you're an orthopedic surgeon.
I am.
Your story starts differently. And I think that it's well worth to start how you started and what made you very interested into this orthopedics and more also into women health. I know that you treat athletes, men and women. You do studies about both genders, but I saw an incredible passion of yours on the stage with huge energy that you were trying to wake up women saying, hey, don't let yourself down. And actually, after this, you can take the stage. You say, we don't stop moving because we age because we stop.
That's right. So, just to frame the way I view this career that you're describing, and I'm so thankful you're willing to talk about your own story of osteoporosis, which is, for those people who may or may not know the word, means the health status of your bones. So, my career sets in the center of three circles. The first circle, which you've described, is orthopedics and performance. So yes, I'm a sports surgeon. I make you walk again. I make your shoulders work again. I'm on the sidelines of big sports teams. So I have a deep understanding of how we have squeezed performance out of top performers. But I don't gatekeep that and just save that for our top sports performers. I apply the principles we know to all of my patients. So there's that one. Another intersecting circle is I was an academic surgeon for 20 years, meaning my job was not only surgery, it was teaching and it was research. And so all of my research and my entree into the longevity sphere is because I've actually done the research. I mean, I think there's a lot of people, and some of them very, very good, others not so good, who read a lot of original work, but never produce anything themselves. And that's fine if they're doing it accurately. But I come to the table having done a lot of the original musculoskeletal aging work. The third circle, which I added in 2012, is the whole health of a woman. So even though I do treat men, what you're talking about is this global screaming from any stage I can get on about how women not only live longer, on average across all countries, 7 years longer, sometimes more, but we spend more time suffering. And that's because aging in men and women are different. Men have a slow, steady, sometimes imperceptible decline in testosterone. Women have a cataclysmic change in the process of our aging when our ovaries stop producing estrogen. And if we're talking about bone, it's one of the key factors about women, why 1 in 2 women will have an osteoporotic fracture in their lifetime. And if that fracture is a hip fracture, men and women, if you break your hip, do not return to pre-fall function, meaning living in their own house 50% of the time, and 30% die. So I think if people are reflecting on that, everybody can think of an old aunt or their grandmother, or, Aunt Mary who fell and broke her hip, or Uncle Claude who fell and broke something and never got back to what. So it's a very common life experience for people to have known somebody or experienced someone with a devastating fracture. And so at the intersection of these 3 circles where I live my life and preach this gospel, orthopedics and performance, longevity and aging, the health of a woman, I find myself alone in the middle because not enough clinicians understand or are talking about how devastating and how important our musculoskeletal health is. So musculoskeletal system is not only the bone that we're talking about, bone, muscle, tendon, ligament, fat, muscle-derived stem cells. Those are all musculoskeletal tissues. And in the United States, where I live, more money is spent on musculoskeletal disease treatment than on heart disease and on cancer. And yet not enough focus is on that. So when...
Do they even work though, these medications?
Well, you know what? The medications are only one part of bone health.
Because
right?
I heard from Dr. Yurt that, it kind of looks like it works, but it doesn't build a quality bone.
Well, before we get to that, let's talk about bone in general.
Yes, sorry.
Let's save that for the end, because bone health begins in people's teenage years, right? So we obtain our peak bone health, meaning the most bone and the most quality we're ever going to have when we're 30. And so I do DEXA scans on everybody that comes into my clinic. And every week I have a 20-year-old or a 22-year-old or, people in their 20s who are osteopenic, which means low bone density, or frankly, osteoporotic, which is what you're talking about, a 40% increase in fractures.
So may I ask then what happens? Why?
Yeah, exactly.
They're so young.
They're so young, but that means several things. Number one, bone density is genetic. Bone density is behavioral. What if you were one of the girls who never had regular periods because you were an athlete. Or, I mean, that was my case. I was a ballet dancer. I would go 6 or 9 months without a period because I was always undercaloried, meaning female athletes sometimes live in a state of chronic energy deficiency and don't have enough body fat and hormonal access to actually have periods and build bones. So that's number one. Number two, even if you're not an athlete, it is a phenomenon all over the world that women are taught to be teeny tiny. Don't take up space. Don't eat a lot of food. And so we never have enough calories. Or number three, maybe you eat enough calories, but you're not active enough. It takes activity to build bones. Bones are stimulated by activity, and high adipose load, high fat load, inhibits bone formation. So for young women who fall in one of those three categories, you may never have reached peak bone mass or equality. And then shortly after that, I call the critical decade for getting our health stuff together, 35 to 45, we start to lose estrogen. Estrogen is a critical factor in bone health. And then we begin our precipitous decline in losing the bone that we've had. And I find, well, two things. Number one, it's not inevitable if we get in front of it. Number two, I find people simply don't know. And so when I am up in the longevity space and people are skipping ahead of basic health tenets, basic health optimization to go to the stuff that we only have rat data on, I'm saying, wait a minute. My approach is if you come to me in a health state that's fine, right? You're fine, you're getting along, but you're not optimized. We're going to take the time to do all the things to optimize your health at baseline. And then we're going to layer on top peak performance like we do for athletes. And then finally, if you're living in this glorified, rarefied air of optimal health, peak performance, okay, let's add some wacko peptide that's only been tested in rats to augment you, right? So that's my approach because I was on the stage, I told you earlier, of the Milk and Global Summit talking about longevity last week. And I said from the stage, we're talking about biologic age and chronologic age and what testing needs to be done. Well, I contend to you the fastest way to die, one of the fastest ways to die when you're old is break a bone. Because 30% of the time that happens. So if we really want to get in front of longevity and living longer, let's be concerned about our musculoskeletal health.
Let me add to my story because they diagnosed me with osteoporosis. Then they referred me to one of the best endocrinologists. And I said, it seems like there's data that 2.5 years ago I had osteopenia. Why nobody warned me saying, hey girl, let's do something? And the reply that I got is like, well, you eat healthy, you do workout, you work muscle, there's nothing we can do. And that I don't accept this as an answer. Then when I had this osteoporosis, the only thing they did is give me one other form of vitamin D until I started working with Dr. Yurt, and that was the number one thing. She dropped every other things that she may want to work on optimizing my health. She says like, listen, with this, you would break your spine, whichever vertebrae it's going to come from, while bending and lifting something, because mine on my spine. My mom's is on the spine as well. Then I understood the severity of the subject, the whole thing. Then I went back 8 years ago, my mom on the ski slope, she was standing. She didn't fell through the bumps and just had rolls. She on the spot, she slit and broke one vertebra. Then I started adding stuff, but still literally no one, her surgeon, my whatever, nobody says hey, do this, do that, lift weight. It's like a fear mongering, oh, do not move much, do not do twist moves. And I see that orthopedic surgeon or if they do as a general practice, in the longevity arena, they take it so seriously because you guys see the bone as an endocrine organ. It's one of your most important organ that you need to keep healthy.
Well, I certainly do. I mean, I don't know many orthopedic surgeons in the longevity space, and I certainly don't know many people who view it as an endocrine organ. I do. And here's why. But I wish other people would. We need to really pivot our mindset about what bones are, because here's at the surface what people view what bones are. If they think about their bones at all, which most people don't, they think when they look in the mirror, oh, look at my beautiful bone structure, look at my cheekbones, or oh, look at my beautiful clavicles in this dress, or oh, you have delicate wrists, look at your bones. That's about as far as it goes in pop culture when it comes to bones. Unless we're looking at a Disney movie like Coco, where in some cultures skeletons are revered, right? Or Halloween in the United States. That's about as far as it goes. However, the reality is bones are not just structural, providing the structural support for muscle. What is muscle without bone? Muscle without being attached to bone would just be a heaping pile of steaming metabolic tissue. It's only beautiful, it's only functional because of its relationship with bone, right? So yes, bone is structural. Bone is also the storehouse of the minerals that our body uses for all function, including calcium, right? Every cell needs calcium for the conduction of its business. So it houses our minerals. It produces our bone, our hematopoietic cells in our pelvis and our long bones. When we're young, it produces our bone cells. Not only that, bone is a metabolic organ, meaning it produces a variety of hormones itself. And if we just take one, the example of osteocalcin, number one, there are many hormones that bones produce, but let's just osteocalcin, produced by the osteoblasts, which are the cells that build bone. When osteoblasts produce this hormone osteocalcin, it goes to the brain and is one of the components of the bone brain axis and helps us build new neurons. It goes to the muscle and helps with glucose absorption. It goes to the pancreas, osteocalcin, and is inherent in insulin sensitivity. If you're a man listening, osteocalcin comes from your osteoblasts and goes to your testicles to help you make testosterone. And the list goes on, and it makes sense because listen, I believe that we are intelligently designed. And if I were designing an organism that needed to communicate from one end of it to the other, why not put it in one of the structural components that goes from the top of our head to the bottom of our toes, right? But here's something I want people to think about, especially in people who are in Turkey or the Middle East, the ancient cultures, right, where we have amazing anthropology discoveries, and we're finding out about how people lived thousands of years ago. How do we do that? One of the ways we do that is by digging up their bones. Bones are the last will and testament of how you lived your life. It tells us how sick you were, how healthy you were. Did you die quietly? Did you die in trauma? We can tell what sex of the person was by their bones. So bones are grossly underestimated and fascinating.
Even though I thought I knew a little bit, I'm just like my mouth dropped listening to you. I know that you have your mom is Chinese, correct?
Yes.
Yeah.
Mm-hmm.
So you have the East and the West mixture. Therefore, you're bringing lots of different cultural qualities to the table. And one of the things that I felt when you were on the stage or sitting next to me while watching other women talking, you had that special, real, genuine care. It's not like coming from your brain or your intellect saying like, hey, this is wrong, you have to change this. The passion in your voice should be coming from somewhere.
Well, we're going to go way back, right?
All right.
If I tell you why I am the way I am, it's going to go way back. And if we just stick to the medicine side of it, right?
Sure.
My right out of college. I came out of my university with a bachelor's degree in biology, and I went right into graduate school where I got a master's degree in cancer nursing. My very first job in medicine in 1991, I looked back at what year it was because I'm preparing another talk for this weekend. In 1991, I started serving as a cancer nurse on an inpatient hospital floor, usually for women. And at that time in nursing in the United States, it was called primary nursing, meaning when people were being treated for cancer, and they were coming from all over the world, actually. We had a lot of people coming from the Chernobyl accident. And so it was an amazing time in cancer care. But they would come once a month for a whole week. They would stay for 7 days. And they would do that for 6 months in a row. Well, the model at that time was that when you came for your first chemo week, and I was your nurse, I would be your nurse every time you came for 6 months. It was called primary nursing. So you can imagine the deep therapeutic relationships that occurred when I started a cancer journey with someone and ended the cancer journey, either because they recovered and they went on to live their lives or because they perished. And at that time, I was only 23 years old. So I say that to say highly impressionable, forming my worldviews, trying to make sense out of life and death. So there I am, 23, 24 years old, treating people arguably in the most desperate times in their life. They are doing everything to try to survive, whether it was sometimes at night, I would watch TV with people, and sometimes they're doing online shopping. And I thought, why are we online shopping? We're treating cancer here. You know why we were online shopping? Because that person just wanted to feel normal again. They wanted to feel like a normal person, not a sick person. Or maybe we were, gosh, there's just so many stories from that floor. But what I learned was deep empathy. A deep empathy for the human condition. I learned not only, you would think that as a doctor and a nurse, I would be the master of anatomy. And I am the master of anatomy. I'm a surgeon. But what I'm the architect of, is trust. People have to trust me to get better, to know that I'm going to help them. So that's something else I learned at that time. But you're asking me why I am so passionate about this, why I care about women enough that 85% of the people who listen to me on social media are women. And here's why. I learned during those cancer years when I was so young and impressionable that women's lives are worth saving. We are the bedrock of family. We're the glue that holds generations together. And I sometimes tell the story of the fact that I learned at such a deep level the value of human life that now, if you come to my house, because I was so young, things that people worry about and spend a lot of time thinking about, I could care less. Like curtains or shoes with red soles, or it's not that those aren't important, but it's just like when you see life and death at such a young age. So I remember this family on 11 Kellogg. It was the name of the cancer floor that I worked on, and they were such a faithful family. The whole family would show up and be with this woman every week. They would visit her every day for the 6 months. And so I knew them. I knew when they would come. I knew about what time of day, and they would all come. And I think what makes me really realize the juxtaposition of life and death is this woman's story. I don't know if any of your listeners have ever been around people in their last days, but you can tell when death is coming. And so I knew for her that her care was not going to end in her living the rest of her life. And so one night it was just she and I alone. And in the hospital at night, we turn down all the lights just so a light above the bed is on so people can sleep. And chemotherapy is given at night. So I'm working with her and her IVs, and I can tell how much she's struggling, and her breathing was becoming something called agonal, which is irregular and labored. But I knew what she was doing. She was waiting on her family. See, I can't even tell this story without crying. She was waiting on her family because we knew that every morning early, her family would come to see her, as they had done all 6 months, as they have done every single morning. So it's getting to be morning, and this hall that this hospital unit we're on, there was a window at the end of the hall that overlooked Lake Michigan, and the elevators were by that window. So it was getting to be about 7:00 when her family came, and I heard the ding of the elevator. So I stepped outside and looked because I was anticipating her family. And there they come around the corner from the elevator, and it was different that day. It was different because she was laying in her hospital bed, agonally breathing, waiting for her family. And it was different because her family came out of the elevators in their wedding clothes, because her sister was going to get married that day, and the family wanted her to be part of that. And so they all came in their tuxedos and their wedding gowns. And I'm 23 years old, standing in the doorway, the family coming towards me with the sister about to embark on the rest of her life, and the sister that I'm taking care of about to end her life. And that juxtaposition of life and death so impressed on me the value of life. We can't take it for granted. My job is not just to be an architect of anatomy, but or the master of anatomy, but to truly be the architect of trust, so that people can experience the type of care that they deserve. And I think that's what you see when I speak from stage and I get really passionate, or you say you're sitting beside me and you feel it. I don't feel it myself then, but I think women are worth caring for. I think women suffer too long. I think the fact that almost every woman who comes to my clinic, it happened many times yesterday. I'm in my clinic today, and women say to me, I have a really high pain tolerance. And I just want to know why we know that. Why it's okay for women to suffer so long, because I've seen suffering women and we don't deserve that.
Dr. Wright, I'm going to open the very famous study that you did in 2024. There are these numbers, 70% of women premenopausal, 80% postmenopausal would experience musculoskeletal syndrome, and that's a word that I think you came up with. Mm-hmm. It's one of the words that you invented. But you know what got my attention is the diagnosis challenges. You say that approximately 40% of women seeking medical care for these symptoms find no structural problems, leading to feel of being dismissed or misunderstood by clinicians.
Well, so let's put some framework around that, right? Yeah. So when we're talking about the musculoskeletal syndrome of menopause, we're talking about the way that the lack of estrogen affects, obviously, the musculoskeletal system. Because don't forget, estrogen is not a sex hormone. We assign the name, estrogen's the female sex hormone, testosterone's the male sex hormone. No, men and women have estrogen and testosterone, both. Estrogen, however, in women has receptors, meaning the little baskets on the cells where the estrogen will fit into and cause the downstream work everywhere. Brain, heart, lungs, musculoskeletal system. So women would come to my office and say, my shoulder doesn't move. I have total body pain. My knees are killing me for no reason. And if you go to a doctor's office and you list off 7 things that are happening, there is simply not enough time to cover all of those. So when I started thinking about it and realizing that estrogen is on every tissue and that we've known for 70 years that arthritis becomes more common in women over 50, we've known for a very long time about the arthralgia, which is total body pain of loss of estrogen, and a variety of, we've known for frozen shoulders since 2011, the 4 stages. And yet women needed a nomenclature to put it all together to talk to their doctors. So I put it all together and called it the musculoskeletal syndrome of menopause and published it. Now, having lack of estrogen and total body pain doesn't mean that there's not also a structural problem. Like, you can still have a rotator cuff tear and have a frozen shoulder and shoulder pain. So what I mean in that paper, when I quote there's a paper that cites it, that you can have pain, but 41% of the time there's no structural deficit found on X-ray or MRI. I'm just pointing to the fact that there must be another reason, and I believe that reason is lack of estrogen.
Now that we open the door for the menopause and estrogen, it's very well worth. And I ask doctors who are coming on the podcast, like you, who are focusing also women hormones and how important it is. Can we please clarify again that this study that has been done way back then and scared the hell out of people, still today, my age people, I'm going to be turning 54 in October. My age people, my friends comes to me and they're like, oh, but we don't want to use. Today, my cousin called me. I don't want to use because it causes cancer. I said, are you freaking out of your mind? I'm just going to use F words and I don't want it on the podcast. But maybe it's well worth for you to kill that knowledge.
So what you're referring to is a study published in 2002. Now, I want to point out, prior to 2002, menopause hormone therapy, estrogen, progesterone, testosterone, were very common. Most OB-GYN doctors knew how to prescribe it. Very common. In 2002, there was a study put out by a big research group called the Women's Health Initiative, which is still ongoing in the United States. There are 42,000 women still being followed. There's 78 to over 100. The study was supposed to look at cardiovascular disease. But what you're talking about is in 2002, they looked at data and asked the question about breast cancer. So the Women's Health Initiative in 2002 came out with analysis of their own data that showed that there was an increase in breast cancer for women who took estrogen. Now, don't turn off the podcast there. That data has been completely refuted, including by most of the researchers who did the original study, and I'm going to give you the data right now. The reason that data is not the end of the story is because most of the women in that study were older. They were in their mid-60s or beyond, number one. Number two, they were being given, the study group were being given conjugated estrogen, meaning not bioidentical, a synthetic form of estrogen from horse's urine. Number two, but here are the data. In the control group, meaning the women who were not given any kind of estrogen, the rate of breast cancer diagnosis is 3 out of 1,000. 3 out of 1,000. And listen, remember, I'm a breast cancer nurse. I am not belittling that. But listen to this data. 3 out of 1,000. In the study group who were given estrogen, the rate of breast cancer diagnosis became 3.8 out of 1,000. So the difference between having estrogen and not having estrogen was 0.8 person, not even a whole person, per 1,000. So from that, an entire generation of baby booming women were denied estrogen. These are the same women who are coming into my ER with fractured hips, Gynecourinary syndrome of menopause, which means they're incontinent and they have bladder infections, with bad hearts, with dementia, partly because they were not given the choice to have estrogen. But here's the kicker: 0.8 per thousand increase in diagnosis, no increase in deaths from breast cancer. So that is the study that people are so afraid of. It has become urban legend. It has become so fear provoking that you get the kind of comment you did from your relative.
Mm-hmm. Yeah. Yeah. I mean, I'm trying to influence people. I had huge requests from my audience to do a special playlist actually on the podcast about women's issue. That's why I was just so willing to add you as well on that podcast list because I'm translating the podcast into Turkish. So many more people are able to have access if they don't even speak English. Dr. Wright, now that, we horrified, terrified people, that's really what I wanted so they can take action. I know that you are also amazing on motivating people and showing them the path, what to do, especially when it comes to the strength training for women and men, but you're just like you're trying to really give the courage to women. And actually today, for the first time in my life with my mother, because she does the Jane Fonda exercises at home. She's very active though, she travels a lot and whatnot. But when you say weight training, there's that weird fear. And when they saw my muscles, they're like, there's a reaction. Oh, what is this? How much muscle? This is whatever, X, Y, and Z. Today, for the first time, she was like, well, I know they say weight training. And then she says that, yeah, I heard that, jumping. I said, Mom, that's great. Let's take you to I know. So let's now help actually younger women as well, because like you said, they're like so tiny, teeny. I no longer fit into my small clothings because of my muscles. But listening to you guys, I said, whatever, I prefer to be healthy than so skinny. What do you suggest? Where to start? What to do?
So I wanna challenge your listeners with two things, and then I'll tell you my prescription. I want to ask them two things. Number one, if you're not investing in your health every day, ask yourself how you want to feel. Do you want to feel okay? Like, I feel okay, I do most things, but do you feel vibrant? Do you feel powerful? Do you feel, frankly, like you can do anything you want, when you want it, when you want to? If you're 20, probably. If you're 40, 50, 60, maybe not anymore. And I ask you, don't you want to feel that way? Don't you want to be strong enough to invest every day? The second question I want to ask is for those people who are listening that are investing in their mobility. Maybe they're doing Jane Fonda, which thank God for her. She started an exercise revolution. It's just not how we do it now. But for those of you who are paying attention to your health, the question becomes, what is your goal? Because if your goal is to be hurt all the time, to spend a lot of time in the gym and see no results, then you just keep doing your moderate intensity exercise every single day and ending up in an orthopedic surgeon's office because you get hurt from overuse. But if you want to age with power, if you want to be strong, if you want to feel mentally vibrant, then here's what I suggest. Because here's what I know from almost 40 years of taking care of people. Until you decide that you are worth the daily investment in your health, nothing else matters. You won't do it. No one can motivate you, only until you decide. And so when you do, here's what I suggest. Number one, if you have no time in the world, if you have 30 minutes a day, build some muscle mass by lifting heavy. We're going to put down the little bitty pink weights that women are handed because we don't want to get big. You're not going to become a bodybuilder. What you are going to become by investing in your muscles every day is lean. You're going to become strong. You may be able to ditch your Spanx. I don't know if Spanx are common in Turkey, but they're those elastic garments that squeeze it all in. You know, I love Sarah Blakely, and the inventor of Spanx. I love her. I think she's brilliant. But listen, if I can lift in the gym and not have to squeeze myself into a girdle, better, right? So number one, lift heavy weights. Number two, I like people to do their aerobic exercise on the two ends of the spectrum, by walking and by maximum heart rate. The walking is great for your metabolism. It's great for your mitochondria. It's great for longevity. The highest heart rate is critical for stimulating your muscle stem cells, for building muscle, also for your metabolism. Those are the two ends of the spectrum. But in the middle, where we're kind of working hard, but not really working hard, we could be wasting our time and not seeing results. Number three, anti-inflammatory, high-protein nutrition. That includes, I don't ask people to take a huge stack of supplements. I just ask them to fill the gaps. So for women, make sure your vitamin D is at a healthy level. Take your vitamin D3 with K2 for absorption. I want you to get your calcium from your food, preferably. It's not that hard to get it from food. Magnesium, 500 milligrams of either L-threonate or magnesium glycinate, which also is helpful for sleep, which is great. And then if you've got an omega-3s for antioxidant and inflammation, if you've got that stack, then there's a myriad of other things you can take. I personally take Fisetin for senescent cells. I take NMN for my energy level, not NAD+. I don't take NAD+. I take NMN so my body can make it. And there's some controversy around that. I think Dr. Ureth actually is not a big fan of NMN. And then I've started taking urolithin A, which has 15 years of research behind it for my mitochondria. I don't take huge stacks of stuff.
So what are the nutritional mistakes that people do for bone health and muscle health?
Not eating enough calories. It takes calories.
Really?
Oh yeah. How are you going to build muscle if you give your body no building blocks, right? So it takes calories, but in a certain distribution, not just trashy calories, right? I like people to eat 1 gram of protein per ideal pound. I was challenged recently by a New York Times writer, and there are data to support up to 0.36 to 0.83 grams per pound. But listen, I'm a doctor. Nobody's going to do that math. So nobody's going to do that math. I can barely get people to eat enough protein the way it is. So I ask people to do 1 gram per ideal pound, knowing that not everybody absorbs all of it, so that we're going to get enough to build muscle. So protein. It can come in any form, but it should be highest quality that you can tolerate. Quality is defined by content of leucine, which is one of the essential amino acids that stimulates muscle. So there's that. There's the protein. There's the carbs. I'm not anti-carb. I'm anti-junky carb. I'm anti-simple high glycemic carbs, unless you're a pro athlete just trying to get some energy in. Most of us are not. So I want women to get 25 to 30 grams of fiber. So that takes complex carbs. And I'll give you an example of what I eat if you want. And then fats, let's choose high quality fats like avocado oil or extra virgin olive oil, that kind of fat source. So it doesn't have to be rocket science when it comes to your diet. It just has to be macro-based. But here's what I find is that most women, A, don't eat enough, B, have no idea what they're eating. So the first thing I have my people do is track their food for a couple days during the week and track it for a couple days on the weekend. So even that knowledge of what you're putting in your body can influence what you're doing. And so that's how I approach it.
With strength training, how does muscle support bone? We understand how bone support muscle to just, carrying it and plus communication. But you have an interesting saying. You say like muscles and bones are cousins.
So the reason I say that, when we talk about the musculoskeletal system, all tissues of the musculoskeletal system come from a common stem cell, the mesenchymal stem cell, right? So there's a stem cell that has the potential to make all musculoskeletal tissue. And bone is derived from that stem cell, muscle, tendon, ligament, fat, discs, the discs of your back. So I say they're cousins because they come from a common ancestor. Therefore, they speak a common language. So not only do bone and muscle and all these tissues actually communicate with each other by producing hormones, fat produces leptin, which affects the muscle and bone. Bone produces osteocalcin, which affects the fat and the muscle. Muscle produces irisin and clotho, which affect the muscle and the bone. Everybody's talking a language that everybody understands. But I think what you're asking me is, how does building muscle build better bone? And the reason is, the way bone is built is by translating biomechanical stimulus into biochemical messages to build bone. So here's how it happens. There's a scientist, a German scientist named Wolf, who described how impact or bashing bones or stress on bones that comes from muscle pulling on bones is perceived by a cell in the bone called an osteocyte, which is a trapped cell living in bone. Osteocytes perceive it, translate that biomechanical stimulus into biochemical messages to the osteoblast, the cell that builds bone, saying, hey, osteoblast, we need some more bone and strength here, build better bone. So muscle is attached. If this part of the white part of my sleeve is my muscle, my hand is the tendon, it's attached to bone. So every time a muscle contracts and pulls on the bone, it stimulates the osteocyte to say, oh, there's a biomechanical signal, I need to build more bone. So that's how muscle can contribute to building better bone.
And also you kind of say something like, if you don't use a part of your bone, let's say your ankles or your wrist or whatnot, the rest of the structure pulls out the minerals to send somewhere else.
So
how do we use all of our bone structures? That might be my first questions. And then are there, besides the, weightlifting, are there special moves and training styles to reverse? Because, one thing is never get it, osteopenia or osteoporosis. But the most important part is like, how do we freaking reverse it?
So there are a lot of pathways towards building better bone or maintaining bone. And so, we talked about nutrition, we talked about building muscle. One thing that I add to all my exercise regimen are, in my new book, Unbreakable, I lay out my exercise prescription pathway as FACE: flexibility and mobility, aerobic, carrying a load, and equilibrium and foot speed. So the first one, flexibility and joint motion, help us move better, help us to do aerobic and carry a load. But equilibrium, which simply means balance, being able to balance on what foot. And I recently posted a balance challenge for the world on my Instagram. Retraining the neuromuscular pathways that lead us to be able to stand upright without falling down is critical, because we don't usually break and then fall. We fall and then break. So if we can prevent falls, that's critical, number one. Number two, foot speed, meaning as we age, we lose our fast twitch muscle fibers, type 2, so we get slower. So if I want to retrain my agility so I don't trip over my work bag, so I don't fall in the street, I don't lose my balance, that can be retrained. And so I add that
Yeah,
to
I
all.
watched that in one of the videos, and I was trying to do myself like these, tapping my
The
foot to the
pogos
floor.
and yeah, it's not as easy as it looks, right?
Yeah.
Yeah, because your brain has to engage. So there's that jumping, agility. But let's say I get this comment all the time from people on the internet. Let's say your knees hurt and you can't jump around like I'm asking people to do. Well, there's a lot of machines that have great preliminary data that can help build bone, such as Power Plate makes a big vibratory plate that has some data that not only that it can help you build muscle, but it can help build bone up through your lumbar spine. So there's that. NASA, when it returns astronauts from the space station, uses mini trampolines, jump roping, a simple jump practice, hopping around. It doesn't have to be rocket science. All of those things can contribute to building bone before we ever get to medications, which are suboptimal at best, but sometimes in desperate times, they have to be used.
Regarding the spinal bone osteoporosis, now it's going to be about me, but I'm sure there are many people who are struggling with it. It seems like, at least that's what I know. Exercise is not really efficient on that part of the structure to rebuild.
It depends on the forces you put across it. I mean, it's hard to ask your paraspinal muscles to pull hard enough because paraspinal muscles are teeny tiny, right? But axial load, your vertebral bodies will perceive that. If you
What
have
does
so much
that mean? Like
jumping hard and bashing your bones.
Oh, wow.
But
Okay.
if you can't do that, then vibratory plates are a good way to send vibration up through your bone. There's a new product which has just been cleared by the FDA in the United States called OsteoBoost. It's a little, it looks like one of those little fanny packs you wear when you're walking around to put things in. It's about this big. It sits on your lumbar spine and produces vibration.
Okay.
And it has preliminary studies. They're not strong studies, but preliminary studies that show it can build vertebral bone density. So, honestly, the best way to have good bones is to build them when you're young. And then as we age, to do this lifestyle intervention that I just talked about. But listen, what we haven't talked about is hormone optimization. If you want to get in front of your bones, make the critical decision whether or not you're going to take hormone optimization therapy, because that works on the osteoblast in a remarkable way to help build bone. And you should make that decision based on science, not based on fear of this study. I always tell people, if you are a data person and you need to see all the studies and you need a deep analysis, read the book Estrogen Matters. It was written by Carol Tavris and Avram Blooming, and it's the world's data on the relative safety of estrogen, risks and benefits of hormone therapy. Read it. Prove to yourself, and then let's make the decision to get on it if you're concerned about your bones.
Are there early signs and, subtle indicators that the person may be going toward the path of osteopenia or osteoporosis without the DEXA measurements and stuff?
Yeah, there's a lot of risk factors to be assessed, but some of the most visual, easy ones to recognize are, is my mother shrinking? Because we know that some osteoporosis is hereditary. So if your mother was 64 centimeters and now she comes down to your chin, she's shrinking. Number one. Number two, are you shrinking? Were you taller at one time and now you're shrinking? Number three, did you have a fracture after the age of 20? That didn't involve running your car into a tree. That's a high trauma fracture. But did you step off a curve? Did you miss your footing? Were you just dancing and you broke a bone? Fracture after 20 is one of the leading predictors of future fracture. Think to yourself, did I miss my periods for months at a time when I was a young woman? Did I just not generate enough hormone balance to have periods? That can be a risk. Did you have a disease like asthma that required use of high-dose steroids, which kills bone? Did you have an autoimmune disease? Did you smoke or vape? Oh my goodness. We still have a lot of work to do in the United States, but when I go to Europe, young women are still smoking like chimneys.
What does it do, this cigarette smoke, nicotine?
The chemicals in the smoke inhibit bone building. I mean, it's just noxious. And we know that not only in building bone, but in healing fractures. In fact, some spine surgeons, particularly in the United States, I don't know about the rest of the world, I don't speak to spine surgeons abroad, will not operate on people if they're smoking because it's such a detriment to the healing of bone.
Mm-hmm.
So those are all risk factors that you can do your own assessment. Like, is my mother shrinking? Am I shrinking? Did I break a bone? Did I have to take prednisone? Mm-hmm. Did I have all the things just to be aware of?
Well, I'm really, I'm very glad that we're sharing all these. And I think that you also suggest people that they should do a DEXA scan at a rather early age.
Well, although DEXA scans are usually not paid for, I mean, in the United States, they're not paid for until 65. In Australia, they're not paid for till 70. That's ridiculous because by then it's very hard to get control of it. I think every young woman by the age of 30 should see what her peak bone mass is. Because if you get a DEXA scan or a REM scan to look at the quality of your bone at 30, you will still have a decade until your estrogen walks out the door to really do some good work. If you don't get it when you're 30, let's get it when we're 40. Because if we wait until we're in menopause and we lose 15 to 20% of our bone density in the 5 years between transitioning from perimenopause to menopause, it just puts us behind the 8 ball. Let's get in front of it. And so, 30, 40. And here's the thing. They're usually not prohibitively expensive, meaning they are a cost. But think about what we spend our money on, a new purse or coffee every day at an expensive coffee shop. Or I just challenge people to find a way to save up what it takes to figure out what your bones are doing.
Now that we're coming to the end of the podcast, what would be not a daily, a weekly workout routine that you would suggest to people, women, men, that to have a really thoughtful, mindful workout, not just like doing anything?
Yeah, well, I love that you asked that. And the good thing about Unbreakable is that it has a 6-week workout. And the app that I'm developing for it has a full protocols that can go on and on. And so, but the principles are using the FACE acronym, which I'm going to repeat. So every week, flexibility and mobility every day. Every day we can dynamically warm up. We can put our joints through a full range of motion. Doesn't take that long. Aerobic. So we want you to do 3 hours a week of baseline training, which means low heart rate. So you can do 45 minutes of walking a day, get the steps in. In 45 minutes, you can do 3 miles, 3.5 miles. So, it will add up to 8,000 to 10,000 steps, including the walking you do for life. So that, and then twice a week, please, let's get our heart rate up. It doesn't have to be running. It can be running up and down the stairs. It can be on a bike. It can be on a rowing machine. That's the aerobic component. Number 3, you must lift weights. You must lift heavy at least twice a week, preferably 4 times a week. And it doesn't have to take long. I get mine in 30 to 45 minutes.
When I did a podcast with JJ Virgin, how she approaches is like, you need to really use your bigger muscle groups. Like doing a bicep curl is not going to be doing much for your...
Well, yes, I'll give you that information. So it's a lot to just try to explain for people to do.
Yeah.
But The foundational lifting are the lifts of powerlifting. So push-pull with your upper body, push-pull with your lower body as the foundation. So what that means is the lower body push-pull is a squat and a deadlift, right? Upper body, it's a bench press and some kind of pull-up. Those are the foundational lifts that you lift heavy. To support those lifts, I'll give you an example. You lift single muscle lifts. So those foundational lifts are multi-joint, multi-muscle group and require balance, right? And so let's say if I'm doing my bench press, right? Multiple joints, very heavy, 4 times 4 is what we discussed before. To support that, I would do the single muscle lifts, biceps, triceps, lats, delts, rows, up to 8 reps, which is the recipe I give my people, 4 sets, right? So we must lift heavy on the power type lifts, on the augmentative lifts, the supporting lifts, a little lighter, but not 20 or 30 reps. Still, for women, around 8 reps. So that's how I prescribe the lifting. And then finally, we talked about F, A, C, and E. Don't forget equilibrium and balance. Every day, practice your balance by standing on one foot when you brush your teeth. Or the other day, I taught the world how to do a balance reach, which is just a way to retrain your balance while standing on one leg.
I did actually last night. I lift my one leg, then the other leg when brushing my teeth, and one side was more balanced than the other side.
Right. Yeah. But the good news is you can retrain that. It's so good.
But you're just giving such practical advices, and I suggest people who are watching us, they should go and really look into your Instagram, because every day there is something that you post, and you also pull information that you shared from other podcasts, and you kind of repost them. And your book is coming out when? Unbreakable. I actually did pre-order, and it seems like it's going to be a great one.
Yeah, I think it will be. It just puts everything in one place. The positioning of Unbreakable is lots of good experts and writers have educated us about menopause. But now what, right? Now what? And so what Unbreakable teaches you is how to build an unbreakable lifestyle going forward so that you can go strong and live longer and actually age with power. So it's coming out August 26th. It's available on every outlet for pre-order. And every Tuesday, we have a special Unbreakable Tuesday, whether I give something away or I have a special session. So people should sign up for that in my Instagram bio.
They should definitely. Dr. Wright, thank you. Thank you so much. That was priceless. Your time is very valuable to me. And the information that you shared, it's super, super, super important. And I really wanted this episode to be like very focused to this very super important, but very dismissed issue. And I know that this is going to bring a lot of sound in my community. Thank you again for your time.
Oh, it's my pleasure. Thanks for having me.